non-communicable disease and wealth. We heard in our early time this is non-communicable disease, diabetes, hypertension, CKD, liver disease, CLD, cirrhosis, and others, the atherosclerosis, stroke, and myocardial infarction, and so many. They are the disease of the rich. But nowadays it is just reverse. The burden of these diseases is equally prevalent in both the groups, more common with the non-communicable disease because the Barker hypothesis says they have more CKD because of the vascularity and other issues. IUGR low birth rate, they are more common in the non-communicable in the low birth in the lower socioeconomic group. So they have higher amount of CKD, higher amount of liver disease, and they have higher amount of pancreatic disease. So they have diabetes, hypertension, and renal failure, liver disease, and they are a little bit compromised because of the finance, in terms of the affording the Medicare and the awareness of Medicare. They are all defective, and at times and the food and other unhygienic behavior little bit more common in the disadvantaged people. So lack of education is also contributed over here. Apart from the money, both the non-communicable disease and infectious disease, and thereby when the disease occurs there, the cost of Medicare, dialysis, and other expensive modalities, the chemotherapy, the other cardiac care, they are quite expensive. In fact, contributing to higher amount of death. In fact, two-thirds of the non-NCD, non-communicable death in the disadvantageous, socio-economic group. So it is important. Thereby, the people should have, the country should have your lifting process from these people must be lifted out, and then they have interim sort of the insurance and the universal healthcare coverage. Otherwise, they will be difficult to live in this earth. And the premature retirement is also more common in the non-communicable disease affected people. Suppose a patient with stroke cannot go to work, and the career, job, and a clean food approach, health, physical activity, they are all less. Outpocketing is common, borrowing money from the other places, 24% over there, and we know that the non-communicable disease has affect in the erosion or the effect on the GDP. In fact, 2% to 8% of GDP to manage the non-communicable disease, and it should take preferably the disadvantageous socioeconomic group.